Good evening, everyone. Welcome to our webinar on regenerative medicine, where we're going to be talking about solutions for joint pain and getting you back and taking control of your life. We're going to go live very quickly, but first I want to cover a few house cleaning items to make sure you maximize your experience and get the most out of tonight's webinar. So sit back, get comfortable. We're going to be going for about 45 minutes, and then we're going to end with a Q&A at the end. To the right, you can find the chat box. Make sure it says to everyone, and let us know who you are, where you're from, what brings you into this webinar. And also throughout this presentation, if you have any questions, go ahead and ask them. I'll try to get to most of them at the end, but I also do have Sam on the computer as well, and he might be able to answer them during this presentation while I'm speaking. Check your audio connection. Make sure you can hear me loudly. If you have any questions in the chat box, let us know if you're having any struggles. And lastly, be open-minded. Get ready to learn about a new approach to your healthcare and taking control of your life. We're going to get started right now. All right, and once again, welcome. We're going to be talking about regenerative medicine and solutions to your joint degeneration and tears. We're talking about a lot of different things: stem cells, arthritis, orange jelly, platelet-rich plasma. I'm with Rejuvenate Medical Group. We are an integrated medical clinic where we're combining multiple professions. We're talking medical doctors, chiropractors, physical therapy, nutrition, an overall wellness approach to getting people back to their lives and making sure they're living out their dreams and their purpose. My name is Dr. Patrick Cucarola. I found a profession that I get to combine the things that I love: being active, being healthy, exploring the world, and I get to help people fix their lives, fix their quality of lives, and that's what gets me out of bed every morning. I'm not a professional speaker. You're probably going to figure that out really quickly if you already haven't. I'm not a college professor, but what we are just a powerful team that has a passion for helping others. All right, so tonight we're going to be covering a lot. Like I said, we're going to be talking about the truth about arthritis and inflammation. We're talking about our America's healthcare crisis, and what's going on in today's world is a crisis, but we're also going to be talking about the bigger picture. What's our healthcare crisis been going on for years and years, and why we continue to get sicker, we continue to become fatter, we're dealing with chronic pain and chronic degenerative diseases, and it's only getting worse, even though we have one of the most expensive healthcare systems in the world. And why is that? And then we're going to get into the heart of the topic. We're talking about regenerative medicine, that being stem cells, PRP, hyaluronic acid, all these other procedures that can actually be solutions for these chronic problems that most of you are probably here for today. And at the very end, I'm going to summarize how you can take action and be proactive with your health. And I'm going to add in a box in the chat box that if at any time you're ready to book, we're offering a free complimentary 15-minute consultation with myself, so we can really hone in on what's going on with you. We can understand your problems, and we can make up a plan that can actually get you out of those pain and get you back to doing the things that you love. And here's this offer right here. There you go. So hopefully you guys can see that book now, and you don't have to book right now, but you can wait until you can hear the rest of this presentation. But if at any time you're ready to go ahead and click that. Well, let's get started. All right. So our purpose at Rejuvenate Medical Group is to help the committed that are willing to make a change in their life and get their quality of lives back to where they need to be. Most of you guys are probably in here for one of these things, right? You have shoulder pain, your back hurts, knee pain, right? Go ahead, type in the chat box. Let me know what brings you into this webinar and why you're seeking out our help, hopefully. There is a little bit of a lag on this chat box, but I'll wait to see what's going on. And hopefully I can tailor based on what you guys write towards this presentation to make sure it's more specific to you guys. Well, not really seeing anything, but most people come to us because they say they're dealing with shoulder pain. They say they're dealing with knee pain or foot pain, but in reality, that's probably not it. It's because one of those things, whether it be low back pain, whether it be shoulder pain, that's affecting their quality of life. They can have degenerative spine disease that's really affecting their sciatic nerve, like you, Lisa, or Lucy, excuse me. But you can have pain. We can usually deal with that. It's when you can't do the things that you love, when that pain in your back or down your sciatic, this makes it hard to walk, when you're just sitting in a car and you're just having that pain down your leg. That's when usually people are seeking out care and they need to find solutions. That's our purpose. We are helping people improve their quality of life, and that's why we do things here at Rejuvenate Medical Group. And what's going on with our healthcare crisis? We have this disease timeline. Basically, on the left, you can see the start of the disease. On the right, you have the end of the disease. What usually happens at the end of the disease? Most people say you die. You could be a half glass full kind of person like me. I'm a pretty lively, happy-go-lucky guy, and I could say maybe you're cured. But for the most part, yeah, you die. But when do you usually figure out that you have that disease? It's usually when symptoms pop up, when something triggers it, whether that pain starts or whether you start to feel sick. That's when you know you have the disease. But when do those symptoms usually pop up? It usually happens towards the end of that disease. That didn't mean that you just got it that day. Cardiovascular disease, the #1 killer in the US. 50% of people that have cardiovascular or heart disease figured out they had it the day they had a heart attack. Their first heart attack was their first symptom. That didn't mean that they got heart disease that day. It had been going on for a while. That symptom just popped up. Same thing goes with cancer. You can have tumors for years and never feel sick, and eventually, now you have cancer. We've all heard that terrible story of someone started feeling sick. They went to the doctor and they found out they had stage 4 cancer. That means they skipped stage 1, stage 2, and stage 3 before they figured it out. And the same thing goes with pain and arthritis and inflammation. You don't wake up one day and be like, oh man, my knee kind of hurts. I must have got arthritis last night. No, you've been having this for years. It wasn't until that pain started that you realized it. Now, the problem a lot with what we do is that we're always trying to hide those symptoms. We're trying to mask that pain with drugs, with other things, but we're never actually going back and fixing the root cause of the problem. And that's a lot what's going on in our medical system. We're always just trying to mask the symptom, but never fix the root cause. And that Rejuvenate Medical Group, we refuse to do that. It's not the absence of symptoms is the goal. It should be the restoration of function, and that's what regenerative medicine is. I got to figure this out at a very young age. We have this massive blinking light, this check engine light going on. We can put a Band-Aid over it. You can just ignore it and just keep driving along and wait till your body goes up in flames or your car goes up in flames. Or you can take action and start doing things to actually prevent and or fix your problem before it goes down the wrong line. Like I said, I found this out when I was pretty young. My name is Patrick. I was named after my aunt who passed away from lung cancer while I was still in the womb. She lived for years in pain, coughing up, but continued to smoke and not take care of herself until the day she died. 2 years later, my grandfather passed away from the same thing, lung cancer. They lived terrible lives at the end of their life, and they couldn't do the things that they wanted to do. Their family was miserable. So not only did they lose their life, but everyone else around them suffered as well. My father lost his dad at a very young age. He lost his sister when he was just 27 years old. I refused to go down that road. Just continued down. When I was 18, one of my best friends was in the hospital, and I was sitting there with his family, and I got a call from my dad, and I thought he was calling to console me, to tell me everything's going to be all right, but no, he was calling to let me know that my other grandfather had passed away from a heart attack. That was his second heart attack. He knew he had heart disease, but he continued down that same road. He didn't exercise, he didn't move, he ate poorly, didn't do anything for himself. He left my grandmother alone, and she's still alive today for the past 20 years because of the poor decisions that he made. His life ended early, and everyone else has suffered. I've never got to experience those people the way I should have. I've been told that I have their lively personalities, that we're all the life of the party, happy-go-lucky people. We all drove motorcycles, but I just get to hear these stories because they passed away before I could ever actually experience it. And I refuse to go down that road. And that's the same thing with pain and arthritis. If you're living with that pain and it's affecting your life, it's probably affecting those around you. And it's up to you if you're going to make a decision to actually take control of your life and actually try to fix the problem until it gets too late. We're about to cover a lot of information. I know that. You might feel a little bit confused, and I understand that. But one of the big things is knowing that you have a mentor in this, or a coach. That man is my father, Chief Warrant Officer Cucarola. He guided me and navigated through life. He taught me so many things when I wanted to make stupid decisions. He was there to guide me in the right way. He put himself through so much. He's, you know, as I've said, lost a lot of family members early on. He's been through 2 wars. He's broke down his body, and he's finally excited to retire and do something and just be with the family and do all the things, live out his dreams. But he broke down his body so much that he was unable to do that. We used to go to Denver Bronco games back in Colorado and climbing up and down the stairs, and we couldn't do that anymore because his knees were so degenerated. We tailored our family vacations to his pains, to what he was limited to do. Like, oh, Dad can't do that. We can't go on that vacation. That's too much walking. So we did something else. We were limited by what he had, and he kept on going through the standard process, taking a lot of pain medications, doing different shots. They just weren't working. And I finally got to say I got to repay back my mentor for everything that he did for me. And we're going to go get into that now. Why most of you are here, is because inflammation and arthritis. It is affecting your joints, your hips, your knees, your back, everything. But what is inflammation? What is arthritis? You guys know? Is inflammation good or bad? Anyone? Most people say inflammation is bad. We're taught that it's the bad guy, but actually it's both. Inflammation is actually the body's way to heal. When you have an injury, when you have an infection, everything on that left side of your screen, your body actually sends in inflammation to actually go to work, sends in the troops to kill the bad guys and start the healing process. The problem is when we don't fix that root cause, the inflammation continues to build up. It continues to just go. It becomes constant, or we keep on doing the same thing. So we're in a constant state of inflammation, and you get to all those things on the right: heart disease, cancer, fibromyalgia. A lot of those are preventable, or at least controllable, if we have the willpower and we have the knowledge to do so. Arthritis is no different. Arthritis is just chronic, constant, uncontrolled, low-grade inflammation that continues to wreak havoc on your body. Whether you get like your first injury, your knee swells up like a balloon, starts to go down, you take some anti-inflammatories, but then you just re-injure it again, you stop moving, and that cascade just continues until it degenerates and degenerates. That's where most of us are at. That's where I'm at as well. But we have the power to make decisions and do what's right for us and actually start to repair and regenerate. Movement is key for arthritis and inflammation, especially in that joint right there. That's a knee joint, but this applies to everything, whether it be your thumb, your low back, your hip. So between those 2 bones, you have a joint space. Basically, in between that is a whole bunch of what's called synovial fluid, and we need to pump and move that joint. What that is, if you imagine a sponge between those 2 bones, when you move, you start to press out, you get rid of that inflammation, you get rid of the wastes, and then it reabsorbs and it brings in nutrients, it brings in blood flow, it lubricates that joint. But when we stop moving, when we're dealing with pain, that inflammation just stays in there, and then that sponge just ends up compressing, and it becomes that dried up, nasty sponge that we've seen on the side of our sink. Movement is key, but the problem is when you first get that pain, that's what you don't want to do. You don't want to move it. It hurts, right? So we just take anti-inflammatories, but that's not fixing the problem. Then you hurt it again. And so it just continues to degenerate. You add in scar tissue, you have more inflammation, so we definitely don't want to move. And that joint just continues to degrade. So what are we going to do about that? And that applies to everything. We're going to keep going down the line. Here's your spine. Lucy, as you were just talking about your low back and your hip, on the left, you have a very healthy looking spine. You can see how tall that joint is, how tall those bones are. The joint space between that disc is nice and plump. There's no pressure on the nerves. It can move easily. Now we start to sit too much. We're just not moving. We have to deal with a little bit of back pain, and you start to compress down. that joint, that disc is starting to plump out, and it might be putting pressure on nerves. There might not be any pain right now, but you're starting to degenerate. Now you're getting into phase 2. You can see those jagged lines. Those are called bone spurs. The body's becoming unstable. That disc space is squished out so much that there's now a herniation putting pressure on that nerve, such as a sciatic nerve. This is what I deal with a ton of patients where they wake up and they're like, oh, my back hurts, I'm just getting old. I'm like, no, you've been degenerating for a while and you haven't fixed the problem. Now you're at this phase 2. And if you don't do anything about it, you're not doing the proper exercise, you're not stretching, you're not doing other procedures, you can start looking like number 3. And that's just a model, but that looks pretty nasty. All those bony spurs have actually fused together. That disc is desecrated. I mean, it's just barely nothing. Those nerves are in constant pain. You might be having shooting pain, numbness down your legs, down your arms. We don't want to wait till the very end. And that's what the big point of this is that the pain can start anywhere along that phase. But if you just keep on waiting, because I'm like, oh, just mild arthritis, I'll just wait until it gets really bad, then I'll do something about it. That's not the right attitude. That's not how we should do a lot of things in life. That applies for knee pain. And this is what I deal with. I was an athlete. I hurt my knee a bunch, twisted it. My knee swelled up like a balloon. Inflammation went in. I popped some pills. It went away. But I started off on that very left, in that clear joint space. You can see right through. Nice, big, open space. I just continued to degenerate. I've had 2 knee surgeries, and each time the inflammation went in, and it just blew up, and it started to add in scar tissue. I'm actually moving okay pretty well. I can do a lot of things, but if you actually look at my x-ray, I look like number 3. That's not the way a knee is supposed to go. And if I just wait until that pain becomes too much, I could be looking like number 4, and that's a surgical candidate. I don't want to have surgery. I don't want to have a replacement. My father was dealing with this just as well. He's broken down his body. He was a college athlete, and he was in the military for years and years, playing with his young sons, and he just deteriorated over time. And now he was looking between 3 and 4 until he found regenerative medicine. He's getting his life back. But if he just continued down that path, he would have just been ridden in a wheelchair, not being able to do the things he wants to with his family. That's not fair to us either. And this is what most people do. This is what Michael, that man I showed you in the video, this is what, I was guilty of, probably a lot of us of, is we start off with joint pain. This is a typical treatment cycle. That's what we see all the time. You have joint pain. So then you start to take those anti-inflammatories. And we already talked about, is inflammation good or bad? It's actually good a lot of times. So we're taking anti-inflammatories. That's an anti-healer. It's doing nothing to actually heal the body. It's just masking the pain. And then when those don't work, we start jumping up to prescription, higher, stronger prescription medications. Same thing, not doing anything to heal the body. Then you jump down to that bottom left, and that's the cortisone injection. That's just a very, very powerful anti-inflammatory. Basically, it gets rid of pain really easy, but it's not specific. It's actually doing harm to the healthy joint. It's breaking it down even more. You can only do this about 3 to 4 times because we know how bad it is for our body. And you also build up a lot of tolerance. My father was shooting it up like every other month through his doctor for his knees, and he eventually just stopped working. It might get a little bit of pain relief. So then they started offering him the scary ones, the surgery. You have arthroscopic surgery and you have replacement surgery. We're going to get into that right now. Sorry for the graphic pictures, but that's exactly what it is. On the top left, you have arthroscopic surgery. They're basically going in with prods and they're scraping away at the degenerative joint. Basically, I compare it to, you have a house that's starting to kind of wear away. You have some chip paints. Basically, they just go in and they just kind of scrape away the chip or the paint chips, but they're doing nothing to actually repaint the house or regenerate that joint. And as those paint chips continue to get scraped off, you're just left with a big, huge hole. Once again, doing nothing to repair itself. And then you get to the scary ones. These are your replacements. This is literally where they cut you open, pry you open, they saw off the ends of your bones, and then they jam a man-made device into them. It's pretty gruesome. It does a lot of damage to the body, but you can only do them about 2 times because it does so much damage to the body. How long do you think these actually last? Go ahead. Answer. Give me a good guess. How long does one replacement last? Most people guess like around 20 years, but in reality, the average is 10 to 15 years max. Remember when I said you can only do it twice? So you do the first surgery, say you're 50 years old, and then you go through the painful, tedious rehab, still dealing with that risk of complications. 10 years later, at 60, you have to have another replacement. Same thing, you go through more rehab, more tedious rehab, pain, all that. Then 10 years goes by again, and now you're only 70 years old. What do you do if you can only do it 2 times? They end up pinning your leg, end up amputating it, or you just live in pain in a wheelchair for the rest of your life. These surgeries are there for a reason, and I'm glad they're there, but you want to put them off as long as you can. You want to exhaust all of your options. This should be your last resort, because once you have surgery, there's no going back. And now we get to why you guys are here and learning actually about solutions for everything we just talked about. Regenerative medicine is exactly that. It is medical procedures that is regenerating the body, repairing and rebuilding those joints. And it includes a whole bunch of stuff: cytokines, exosomes, hyaluronic acid, and stem cells. It's the powerhouse to actually stimulate the body to get to healing and regenerating. A stem cell is basically the basic blueprint, the template for everything in your body. When you're first born, or when you're just first conceived, you're just this little 500 cell blastocyst. Most of those are stem cells because we need to grow into us as humans. So it proliferates or multiplies to become more stem cells, and they could go off to be a muscle cell, a nerve cell, break down to a bone, just starts to grow. And as we age, the amount of stem cells goes down. When you're first born, 1 in 10,000 cells is a stem cell. Why? Because we're growing. We're like, oh, I need to grow a foot. I need to grow taller, bigger. As we age, it just goes down and down and down. When you're 60 years old, the number is 1 in 2 million for stem cells. It's one of the theories why we age poorly, why we can't heal as quickly. We've known about this for a very long time. This is Dr. Maximilian Stern. This was published in 1913, over 100 years ago. He was an emergency doc, and he was in the burn unit. He would go over to the labor and delivery unit, take the amniotic membrane and place it on the burn victim's skin. What they saw was that the skin was growing back healthier, the muscles were growing back healthier than actually the surrounding tissue that wasn't affected by the burn. That was published a long time ago, and we've only studied it, and now we're actually using it for our benefit, using it for orthopedic reasons, which we're going to continue to get into. There's a bunch of different types of regenerative medicine, one of them being PRP, or platelet-rich plasma. This is autogenic, meaning that it comes from us. Basically, we're taking our own blood, we're going to centrifuge it or spin it out, and we're going to separate the platelet-rich from the platelet-poor. We're going to use the platelet-rich, which is a concentrated healing power, and we're going to inject it into our injured sites. And this is going to stimulate the positive, the healthy inflammatory process using those cytokines, hyaluronic acid, exosomes, and possibly bring in your own stem cells to actually go to healing action. But then we also have the stem cells, which is the powerhouse. These are called mesenchymal stem cells. This is the holy grail of regenerative medicine. Mesenchymal stem cells are a type of stem cell that becomes your body connective tissue. These are your muscles, your tendons, your organs, everything. You see those cute little tentacles hanging off? Those are called telomeres. Basically, those are like Wi-Fi signals. So these telomeres are waiting to be called to action. If there's an injury, or if we're going to stimulate some kind of healing response, these stem cells are floating around in our body, and they're waiting to be called to action. We're able to concentrate this into a smaller package, but a ton of it, and deliver it right to the injury site. But as we age, we've already talked about how the mesenchymal stem cell, just the amount of stem cells in our body drastically goes down. The telomeres become a little bit shorter. So now we don't have as many troops, and they're not getting called to action as good as they were before. That's the problem with aging, which is why we use a fountain of youth, and we're using a viable, more effective source to heal our injuries. And that comes down to Wharton's jelly. This is the richest source of mesenchymal stem cells in the human body. It's found in the umbilical cord, because it's right next to the baby, which makes sense. As we're starting to grow, it's like, oh, I need a foot. Let's grow a brain. It pops right over. And the amazing thing about it is that it's immune privileged, meaning it's very safe. It's kind of like a universal blood donor. Everyone can take it. Your body's not going to attack it. So we can utilize this for our own benefit. Remember, I said it's the richest source of mesenchymal stem cells, the stuff we want to use to rebuild and regenerate. And it's very, very, very safe. Over 120,000 injections have been done through the company that we sourced through, and only 19 complications. And those complications were minor. Those were skin irritations due to sloppy procedures, had nothing to do with the actual source or these stem cells. It's very, very safe, better than your flu shot infection rate. I told you at the beginning, it's not just about stem cells. It's a whole bunch of tissues. We're talking growth factors, proteins, collagen, hyaluronic acid, plus stem cells. I look at it like, if you imagine stem cells being the soil, if you don't have the seeds, if you don't have the water and the miracle grow, you're not going to grow that beautiful plant or your body. So we're adding that in. We're talking a whole bunch of growth factors. We're talking cytokines, the collagen, and hyaluronic acid. Hyaluronic acid is a natural substance in our body, and sadly it goes down as we age. But it's kind of like your body's lubricant. It's WD-40. So we're going to take that. It's going to clean out the joint space, smooth it out so we can actually move. And we talked about how movement is good for arthritis. Now we're adding all this into one injection to give your body the best chance at healing. Through these injections, you have a stronger source of that hyaluronic acid than what you find just in a regular hyaluronic acid injection by itself. It's 20 times more. This is a powerhouse to get you to heal. Going more down the line, if you see all those big words on the left side, those are all the different types of cytokines, basically your healing factors. And at the bottom, you have MSC, that stands for mesenchymal stem cells. In that black box I have boxed for you is pharma or pharmacology. So you're talking your cortisone, your steroids, your anti-inflammatories, your synthetic injections. Do you see all those check marks? No, you don't. There's none, because they don't do anything to actually heal the body. Now you see in the red, the amniotic matrix, the umbilical cord matrix. That's what we're using for our regenerative services. And you can see all those check marks. And down at the bottom right, you can see the 3 check marks for mesenchymal stem cells, those viable stem cells to actually repair and regenerate. And those 2 columns to the right, those are what a lot of other clinics are starting to use for these injections, and it comes from your own body. So they're using bone marrow, or they're using adipose tissue or fat, like a liposuction. Basically, they're harvesting your body's own stem cells and then injecting them into the injured site. They're having some okay success, some really great. But you can see just the amount of healing factors that are in them, as we've already talked about. As we age, those numbers start to deplete. Why wouldn't you want to use the fountain of youth, the powerhouse, to actually heal the body? And that's what we're providing for you. And it's a very easy in-office procedure. 1 hour, maybe even less. No anesthesia, no hospital stay. You can walk in and you walk out. 0 recovery time. And we expect clinically significant results in about 1 to 3 months, but you can see results maybe a week later from all the other growth factors, hyaluronic acid. Some people after a week start to feel they're like going upstairs when they couldn't do that before. And the stem cells haven't even fully kicked in to actually start to repair and regenerate. And all those factors continue to work. Research has shown for up to 9 months after this injection. So you're continuing to get better, but the biggest results happen between 1 and 3 months, and those are life-changing results. Talk a lot about the science behind the stem cells, the cytokines, but let's get to the fun stuff. You guys saw the video of Michael in the very beginning. We're going to break it down a little bit more for you. He's a 58-year-old. He was an ex-professional dancer, Pilates instructor, just a lively guy. That's what I heard, but when he first came to us, he was debilitated. His morale was down. He was almost depressed. He was in tears when he told us some of the stories. He couldn't lift his arm above his, waist height. Couldn't even put deodorant on because it pinched too much. He had tried everything. He'd done, PT. He had done all the different shots, just rested, and he plateaued eventually, and he just was debilitated. He invested in his health and saw some amazing results very quickly. 1 week after the injection, he's already feeling stronger, feeling he can move, arms going above his head. 4 weeks later, he's 50% better. And you saw the video of him playing fetch with his dog for the first time in 2 years. 2 years of pain, 2 years of not being able to play with his dog, and he was doing that. He went skiing. He was using his poles, moving around, loving life. He went back to work as a Pilates instructor because he could actually do things. End of 3 months, he described himself as feeling 90% better. He's exercising fully, starting to lose a little bit of weight just because he just feels better, is moving better. He's teaching Pilates at 100%, and he started trying those handstands again. He's getting his life back. He scared the heck out of me. He called me a couple months ago and said, we need to do another injection of those stem cells. I'm like, oh, what happened? You were doing so good. He's like, oh no, that shoulder's doing great. My other one, I fell on it, it hurts. And I want to do my back too, because I've been having this pain for a very long time, and I had such good results with that first shoulder injection. He wanted to do the rest of his body because he saw such amazing results, and he got his life back. And that's exactly what we did, and he's living out his dream. I don't like to play favorites, especially with patients, but if I had to pick one of my favorite patients of all time, it was this woman. Her name is Lynette. She came to us with terrible knee pain, both knees just degenerated, almost bone on bone. She's an anesthesiologist, so she works on her feet in the hospital all day, and she hated her job because she was in pain all day. And how are you supposed to take care of people if you're not feeling good, if you can't even deal with your own pains? She didn't have any big injury that happened. It just wore down over time, and it just kept getting worse. And then she couldn't exercise because it was so painful. So then she started to gain more weight, and then she became really depressed. And that's how we saw her when she first came in. She talked about going up the stairs. She had to turn sideways and slowly go up the stairs. And this is a day-to-day basis. And she continued to gain more weight, continued to get more depressed. And then she decided to invest in her health and quickly saw results. You can see on the left how degenerated her knee was. That is basically bone on bone. Her knees are slanted in so much because one side is compressed down and collapsing. 6 months later, it's not a perfect knee, but you can start to see through that joint space. This isn't just stories. This is actually happening. This is repair and regeneration happening in your own body. 1 week after that injection, she was already able to start going up the stairs, still in pain, but she was able to do it. 1 month later, she said she was feeling 50% better. She started biking. She actually bought that Peloton bike for her home, and she started exercising again. She was becoming happy. She was losing that depression because she was able to move. She started to eat better because she just felt better overall. She even hired a personal trainer and started pushing herself more. She couldn't do that before because she couldn't even deal with any type of exercise because of how much pain she was in. She used to love going to concerts, she told me, but she couldn't because she had to deal with those stairs and just deal with crowds and just dealing in pain, and she couldn't do it. She actually invited me to go to an Andre Bocelli concert with her as a thank you for everything we had done for her at Rejuvenate Medical Group. I went, we met up with her friends, we had a great time. And at the end, one of her friends, I'd never met her before, came up and gave me the biggest hug. And then I looked down and she had tears running down her eyes and said, thank you. My friend couldn't do this for the past 8 years. She refused to go out. She refused to even try to go up and down stairs. And we were giving her life back. That was just 1 month. 3 months later, she's back to hiking. After 8 years of pain, she went on a hike with her niece in Hawaii. She had lost 50 pounds. She came back about 2 weeks ago and she looks like a different person. She's 90 pounds down right now. And she actually is a new person. That first person I met was depressed, sad, moped around. She came in lively, happy. She loves her job again. She's excited to go back and work because she can actually help people and she's not dealing with that pain. That's the power of regenerative medicine. And it just continues. My father, once again, he was a war veteran, gave the world everything he could, broke down his body year after year. We used to do so many things as a family, and that was stripped away from him. He retired and he wanted to live out his dream. He had so many plans, but he couldn't because of the chronic pain that he was in. He did regenerative medicine, and you can see all those other pictures and what he's doing with his life. We went hiking in La Jolla. That's a 65-year-old man in that shirtless picture showing off his arms because of how strong he is, because he works out harder than he was in his 30s. He is loving life. We're going out as a family. We're going out hiking. We went to Mexico and we're cave diving, and all of us are gleaming smiles. We finally went back to that Denver Bronco game because he could go up and down the stairs. That's my brother and I, smiling ear to ear because we have our father back and we're doing the things that we love with him, and he's living out his dreams and he's going to continue. That's my why. And that's our purpose, is to make sure this information is out there for you guys, so you guys know that there is a hope, there is a chance that you can live out your dreams too. And all it takes is one step. We're offering that to you right now. Go ahead, you can click that book now at any time. You can follow that link. It's a free complimentary consultation. It's supposed to be 15 minutes. It's probably gonna take a lot longer because we're gonna delve deep. We're gonna learn what you're going through, your problems. We're gonna get to the heart of things and what you want to do, what you've tried in the past that haven't worked and why you came to us. And we're gonna develop a plan specific to you so you can get the results and you can live out your purpose. You can also call our office. Thank you guys for learning from me tonight on regenerative medicine. If you took anything away from tonight's presentation, I hope I inspired you that there is hope, that you do have a choice to take control of your life. Thank you guys very much. We're gonna be taking a few questions if anyone has some. But overall, I think I can answer most people's questions is, can regenerative medicine help me? The answer is yes. We just need to go through a consult and examination and make sure that you're a candidate, and then start up a plan. And the first step is free. It's a free consultation. Come learn from us.